Hi everyone, my name is Steve. You can find me at insuremesteve.health. I'm a Revolt Healthcare Alliance agent, and today I want to talk to you about just your routine care versus the catastrophic care that you might need, and how you can consider these two options when it comes to shopping for your health insurance. So with routine care, this is just the regular doctor visits, the annual exams. You got cough and you got congestion and need to go see a doctor kind of care. And a lot of people are relatively healthy. The other type of care is the catastrophic. What happens if you get that terrible disease, you have that heart attack, or worse, you're in a catastrophic accident and you've got days to spend in the hospital along with physical therapy to recover. So I want to talk about how you should consider these two things and what the overall U.S. population looks like in terms of what their routine care expenditures might be. And this might be something that fits with your overall care needs as well. So you've seen me share this chart before. It came from a study the Brookings Institute did with the Hamilton Project. And what you see here is the percentage of individuals that have out-of-pocket expenses. On the far left, you see over 16% of individuals had zero out-of-pocket expense. Zero out-of-pocket expense. And just like any other distribution, there's a bell curve with it, but the curve kind of peaks anywhere between about 100 to 1,000. So let's call that $400, $500, where the majority of the insured in the U.S. have around $400 or $500 in out-of-pocket expenses. Now keep in mind, the way that marketplace plans work, you pay a very costly premium to have access to a very high deductible plan. So ask yourself, does this make sense that I have major medical coverage that is costing me on average across the U.S. about $400 a month in a premium, so that if I need to go to the doctor, I'm going to end up spending the money out of my pocket anyways because I got copays, I got co-insurance, and I got to meet my deductible? Or is a better alternative for you to just pay that out of pocket anyways because maybe you only go see a doctor twice, maybe 3 times a year, and instead seek coverage for the catastrophic. Make sure that you're insured if you get that heart attack, if you get that cancer diagnosis, and you can get the medical coverage that you will need to return to a healthy state. Or if you get in that terrible accident and you need to remain in the hospital, and worse, maybe even have extensive surgery to recover along with extensive physical therapy. So your options aren't always just go pay for a major medical plan, and if you don't need it, you're over-insured and you're paying more than you need to. If you're relatively healthy, and the majority of the U.S. actually is, 5% of our population, remember, drives 50% of our healthcare spend in the U.S. That 5% is the chronically ill individuals that unfortunately need a healthcare system that takes care of them and hopefully can return them to a life of health. But not everybody is in that 5%, of course, and you have an option. Pay for routine care out of pocket. Don't pay for a high deductible plan. Make sure you pay a premium to cover you for the catastrophic. Remember, my name is Steve. If you have employees or you are an employee, when you insure with me, you insure with Steve. I am your dedicated health agent that provides concierge service for all your healthcare needs. If you're interested, go to insuremesteve.health, fill out the form, and you and I will talk soon about how I can help you with your health insurance. Have a great day.